Treatment of choice for bladder stone. What is the treatment of choice for bladder stone? Good evening, everybody. Today we are going to do the multiple choice questions of surgery. If you are able to hear me clearly, please type yes in the chat box. Whatever the answer is there, please type in the chat box for each multiple choice question. So let us begin with number one, treatment of choice for bladder stone. Treatment of choice for bladder stone. Four options are given. They are option A, transurethral lithotripsy. Option B, percutaneous suprapubic lithotripsy. Option C, vesicotomy and stone retrieval. Option D, intravenous antibiotics. So, what do you think is the correct answer? The correct answer here is transurethral lithotripsy. Transurethral cystolithotripsy is the most common procedure used to treat adults with bladder stones. If the stone is small, ultrasound lithotripsy. If the stone is large, laser lithotripsy. Lithotripsy for and suprapubic cystolithostomy. So the correct answer here is transurethral lithotripsy. What is the main hazard of ectopic testis? Option A, impotence. B, carcinoma development of carcinoma. C, liable to injury. D, hernia development. So the most common problem, main hazard of ectopic testis is liable to injury. It is liable to injury. Now let us move on to the next question. Which are the following are the treatment option for cystocele? Cystocele. Treatment option for cystocele. A. Anterior colporrhaphy. B. Transvaginal tape. C. Transobturator tape. D. All of the above. Traditionally, anterior vaginal wall repair, that is anterior colporrhaphy, was performed vaginally, now replaced by vaginally inserted tape, that is known as transvaginal tape, or transobturator tape, that is TOT. So the correct option here is D. All of the above. Best time for surgery for hypospadiasis is at what age? Best time for surgery for hypospadiasis is at what age? See, operations for hypospadiasis are routinely performed when the patient is between 6 and 18 months of age. The, the infant has good tolerance to surgery and anesthesia by the age of 6 months. The child is well aware of his genitalia and toilet training by the age of 18 months. So the most suitable age for operation of hypospadiasis is between 6 and 18 months. The degree of hypospadias dictate the need for repair. If the opening is glandular or coronal, the penis is usually functional both for micturition and procreation, and repair is done primarily for cosmetic region. Openings that are more proximal on the shaft require correction to allow voiding while standing, normal erection, and proper sperm deposition during intercourse. The commonest procedure for distal hypospadiasis is tubularized incised plate urethroplasty, while the technique that utilizes the foreskin are commonly used for proximal hypospadiasis. Now, what are the complications of hypospadiasis surgery? There can be urethro-cutaneous fistula, which is most common, recurrence of choroidy, urethral stricture, meatal stenosis, and infection. So the correct option here is C, 6 to 10 months. Now let us move on to the next question. Which enzyme is of diagnostic importance in chronic pancreatitis? Chronic pancreatitis. So which enzyme? A. Amylase, B. Pancreatic polypeptide, C. Lipase, D. Serum interleukin 6 levels. Correct option here is lipase. Elevated lipase levels are more specific to the pancreas than elevated amylase levels. Lipase levels remain high. Modified Koch Whipple operation is devised to preserve which part of stomach? A. Fundus, B. Body, C. Lesser curvature, D. Pyloric antrum. So correct option here is pyloric antrum. The procedure is also called pylorus preserving pancreaticoduodenectomy, PPPD, or PP Klosch Whipple's procedure. It is the procedure of choice for most adenocarcinoma of the head of pancreas. The original pancreaticoduodenectomy, as proposed by Whipple, included resection of gastric antrum. The Whipple's procedure is now reserved for situations in which the entire duodenum has to be removed, or where the tumor encroaches on the first part of duodenum or the distal stomach, and a PPPD would not achieve a clear resection margin. Pseudocyst is developed in how much duration following an attack of acute pancreatitis? It is 4 or more weeks. True of umbilical hernia. A. Most common content is large intestine. Most of the umbilical hernias disappear spontaneously. So the true is most of the umbilical hernias disappear spontaneously. Treatment of congenital hydrocephalus. It is a ventriculoperitoneal shunt through which the fluid is drained into the peritoneum. How much percentage of blunt trauma injuries to spin and adult are currently managed non-operatively? About 80% of blunt trauma injury to spin in adult are currently managed non-operatively. Which of the following is false about Jenker's diverticulum? Most patients are above the age of 50 years. It is the most common esophageal diverticulum mucosal outpouching through Killian's triangle. Cervical webs can be associated with Jenker's diverticulum 80% of patients. So the cervical webs can be associated with Jenker's diverticulum 80% of patients. This is false. Downhill esophageal varices develop as a result of obstruction seen in superior vena cava. Correct option here is C, superior vena cava. Pantaloon hernia is also called as, we all know it is saddlebag hernia. Sometimes they ask about Bochdalak's hernia. Bochdalak's hernia is a posterolateral hernia. Rolled up momentum is seen in case of peritoneal tuberculosis. So the correct option here is A, peritoneal tuberculosis. Treatment of choice for low fistula and NO is A. Fistulotomy, B. Intravenous antibiotics, C. Stage surgical resection, D. None of the above. It is A. Fistulotomy. Colonoscopy is not indicated in A. Meant to be, B. FAP, C. HNPCC, D. Cronkite Canada syndrome. The correct option here is meant to be. Simplest investigation to be performed in suspected cases of gastric cancer is A. Double contrast radiography, B. Plain radiography, C. CT scan, D. Endoscopy. Correct option is CT scan. Plunging ranula, you can see in the figure. It is a cystic growth of sublingual gland. Most common site of direct hernia is it is Hasselbalch's triangle. Treatment of contaminated wound of leg is debridement and antibiotics. Most important diagnostic feature of congenital hypertrophic pyloric stenosis, it is non-bilious vomiting. Gallstone impacted causing intestinal obstruction is gallstone ileus. Hemorrhage after thyroidectomy is due to superior thyroidectomy. Anal fissure is diagnosed by colonoscopy. 70-year-old female with bleeding from proximal colon, it is definitely CA colon. Bleeding per rectum in old age suggests a diagnosis of colorectal carcinoma. Symptoms of colorectal carcinoma are non-specific and generally develop when the cancer is locally advanced. Symptoms vary with the anatomic location of the tumor. Abdominal pain, anemia, microcytic hypochromic indicative of iron deficiency, fatigue, palpitation, and even angina pectoris. Mass in the right iliac fossa, a Siegel carcinoma can act as a lead point in interception. So let's once more revise the entire thing. Treatment of choice for bladder stone is A. Transurethral lithotripsy. What is the main hazard of ectopic testis? It is more liable to injury. Which of the following are the treatment options for cystocele? Anterior colporaphy, transvaginal tape, transobturator tape, D. All of the above. Correct option here is D. All of the above. Best time for surgery for hypospadiasis is at what age? Between 6 to 10 months of age. Which enzyme is diagnostic importance of chronic pancreatitis is lipase. Modified Koch Whipple operation is desired to preserve which part of stomach? Pyloric anatomy. Pseudocyst pancreas develops in 4 or more weeks. True of umbilical hernia is most of the umbilical hernias disappear spontaneously. Treatment of congenital hydrocephalus is ventriculoperitoneal shunt. How much percentage of blunt trauma injury? It is 80%. Which of the following is false about Jenkins diverticulum? Cervical webs can be associated with Jenkins diverticulum in 80% of patients. Downhill esophagus virus develops as a result of obstruction seen in superior vena cava. Pantolin hernia is known as saddleback hernia. Rolled up momentum is seen in cases of peritoneal tuberculosis. Treatment of choice of low fistula and ano is fistulotomy. Colposcopy are not indicated in men to be. Simplest investigation to be performed in suspect case of gastric cancer is CT scan. Plunging annuli is cystic growth of sublingual gill. Most common site of direct hernia is Hasselback's triangle. Treatment of contaminated wound of leg is debridement and antibiotics. Most common diagnostic feature of congenital hypertrophic pyloric stenosis is non-villous vomiting. Gallstone impacted causing intestinal obstruction is gallstone ileus. Hemorrhage after thyroidectomy is due to superior thyroiditis. Anal fissure is diagnosed by colonoscopy. 70-year-old female with bleeding from proximal colon, carcinoma colon. So today we have done surgery, most important MCQs. So I wish you all the best. You can click the link in the description box to join by masterclass, which will help you in rapid revision, and it will be very helpful for you for the preparation for the NEET PG. It will prepare a blueprint for the preparation of NEET PG. It is a rapid revision class, and please like, share, and subscribe. Please subscribe and hit the bell notification so that every day I do some live class or some if I upload some video, it will be available for you. And please watch the video again and again. It will be helpful to revise it properly. Already I have revised it in this video, the things, so that you can, if the question comes in the examination, you will be able to answer it correctly. See, accuracy, speed is most important in NEET PG entrance exam. I wish you all the best.